Looking for a unique piercing that's sure to turn some heads? Why not try the Dahlia piercing? Hi, it's Riley with Bodyartforms. Let's get into it. First things first, a Dahlia piercing is a pair of labret piercings, one set on each side of the mouth, close to the corners. They are risky and difficult to heal. While similar, the placement makes the Dahlia piercing different from a cheek piercing, which is generally set in the dimple area of the cheek. And if you were curious, the Dahlia piercing is in fact named after the Black Dahlia murder due to the placement's similarity to the smile-like cuts left on the victim. A bit morbid, yes, which is possibly why some have instead opted to call this the Joker piercing. Dahlia piercings are advanced piercings that are anatomy dependent. That means it's important to go to a reputable piercer who really understands cheek anatomy. They may have to avoid muscles, salivary ducts, and major blood vessels. Additionally, your bite will be considered to make sure the piercings don't damage your teeth. So be prepared for the piercer to look inside your mouth, ask you to open and close your mouth, and feel around your cheeks. If your anatomy does allow for this piercing, just know that the placement might not line up exactly where you imagine. And if it's done wrong, the consequences can be serious. So if you're thinking about Dahlias, do your research and go to an experienced piercer. And if they don't do a thorough consultation, go see a different piercer. If you do have the right anatomy, the Dahlia uses 14 gauge or 12 gauge labrets, also known as flatback studs. Your piercer will use high quality implant grade titanium and fit you with a pair of extra long labrets to accommodate for swelling. Be prepared for significant swelling, which is fairly common in oral piercings. As the swelling goes down, you'll need to get downsized to avoid complications and accidentally biting down on the jewelry. It's common for someone to downsize multiple times during healing. While everyone's body is different, most report that Dahlia piercings are low to middle on the pain scale, though remember that it's a pair of piercings, meaning you have to put up with the pain twice in a row. The healing for Dahlias is long and difficult due to the constant movement from eating and talking. It can take roughly 1 to 2 years to heal, though it can be longer depending on your body and if you have any complications. During this time, it's important to keep your piercings clean and to avoid touching them. Clean them about once a day using a saline spray on the outside of your mouth and an alcohol-free mouthwash on the inside. Also, make sure to rinse your mouth after every meal. You should avoid swimming in bodies of water such as lakes, the pool, or the ocean, as they harbor bacteria that can cause an infection. You may also need to temporarily avoid any food that's spicy, acidic, or overly salty. And if you wear makeup, avoid applying any on or around your new piercings until you heal. Now, let's talk about the risks. There are a couple other very important things to keep in mind with the Dahlia piercing. Firstly, like with all oral piercings, you need to keep an eye on your oral health. Watch out for any kind of gum or enamel erosion. Also, be careful when eating, as the location of this piercing makes it easier to accidentally bite down on, which could cause damage or chipping to your teeth. This is why proper placement along your bite line is so crucial to minimize damage. We also can't stress enough how important it is to downsize your jewelry once your swelling has resided to help prevent this. Downsize your jewelry as many times as you need to, or if the piercing gets irritated and swollen, you may need to switch to longer jewelry. If you see any damage to your oral health, talk to a dentist immediately. Something else to think about is scarring. While there's a possibility that the scars left may look like dimples, they can also leave large noticeable discolored or hyperpigmented scars. So if you're worried about scars, this piercing might not be right for you. Another thing to watch out for is migration and rejection. This piercing will see a lot of movement due to its location around the mouth, which could cause irritation or migration. And if pierced too closely to the corner of the mouth, could shift and reject altogether. If you notice your piercing migrating or starting to reject, go see your piercer for advice. We hope this video was helpful. Do you have a Dahlia piercing? Are you planning to get one? Let us know. And while you're at it, don't forget to like and share this video and follow us on all of our socials at Bodyartforms. Bye!